Following a recent subscriber poll to find out which joint in the body is the one that causes the most problems, the knees came out on top. So I have 5 strength exercises in this video that will help to reduce your knee pain. Hi everyone, and welcome to Exercise for Health. And knee pain is one of the most common health issues that we all face as we get older. There are certain conditions that can cause it, such as patellofemoral joint pain, normally brought on by excessive overload of the knee, meniscus tears, ligament tears, iliotibial band syndrome, poor tracking of the kneecap, patellar tendinopathy, and osteoarthritis. However, in all cases, research has shown that strength exercises can be beneficial to help reduce knee pain. So I'm going to explain 5 exercises that should only be performed if they don't increase the pain symptoms, that can be done on 3 or 4 days of the week. You don't need to do all 5, you may just pick 2 or 3 that work for you, and you should aim to do 3 sets of 10 to 15 repetitions for each exercise that you pick. Most of these exercises are shown on one side, but even if you only have knee pain on one side, it's worth doing both sides to maintain a good balance of strength. You won't need any additional equipment to perform them, and as knee pain can also be caused by weaknesses or imbalances further up the kinetic chain, and in a lot of cases this being around the hip, some exercises won't be targeting the muscles directly around the knee. If you're unsure if any of them will be suitable for your knee condition, then as always, check with your doctor or physical therapist first. The first exercise will activate the weaker muscles around the hip that can be one of the major causes of knee pain. Start by lying on one side with the top leg you want to work straight, then begin to lift that leg upwards and backwards, which will abduct and extend the hip. When you reach the end of your range, you should feel a tight squeezing sensation around the side and back of that moving hip. Hold for a second before lowering back down and start again. Ensure that your pelvis doesn't rock backwards during the movement, so the hips remain stacked, and don't outwardly rotate the hip. To monitor this, your foot will always point forwards or down, but it shouldn't rotate and point up. If you struggle to manage 10 reps, you can make the exercise slightly easier by having the knee bent at 90 degrees, shortening the lever. However, if you want to progress the exercise, you can either add an ankle weight, increasing the resistance on the muscles, or you can use a small looped resistance band wrapped around both knees so it's anchored to the bottom leg. You can alternate between sides for multiple sets, or do all the sets and reps on one side before switching to the other leg. The second exercise is a glute bridge, but only pushing through one foot. Start by lying on your back, bringing your feet close to your bottom, bending your knees. Raise one foot a few inches away from the floor, tighten up your core muscles, and then drive the hips upwards, pushing through the foot until they're in alignment between your knee and shoulders. Make sure that the pelvis stays level, as there will be a tendency for it to tilt as you're pushing through one side. After holding the top position for a second or 2, lower back down and then start the bridge again. Stick with the same side for the desired reps before switching to the other leg. If you find this one too challenging, start out using both legs at the same time, so essentially a standard glute bridge. However, if you need to make this exercise harder, you can place the foot on a step or chair to generate more movement, making the muscles work more. The third exercise is a kickstand squat. This is very similar to a standard squat, except one foot is placed back about the same distance as the feet are apart. This back foot should be on the ball of the foot without much weight through it, so that the front leg ends up doing most of the work. As you squat down, make sure the hips are pushed backwards, but keeping as much weight through the front leg as you can. If you find this hurts your knee, you can change it to a split squat, moving the feet further apart, which will bring your center of gravity backwards, placing less demand on the front leg and knee. However, if you find this one easy, you can progress it to a Bulgarian split squat, placing the back foot on a step or chair or bench behind you, adding more weight to the front leg. Just make sure with this one that the front knee doesn't move inwards during the movement. As you are lowering down, think about driving the front knee outwards but keeping the foot flat on the floor. Although both legs are working with this one, the aim is to place more weight on the front leg, so make sure to do this one on both sides. The fourth exercise is a hip hinge and does involve balancing on one foot, so it's worth doing this near a support so the focus is then on the exercise. Start in an upright position and take one foot off the floor. Placing a slight bend in the support leg knee, begin to bend forwards at the hip, maintaining the bend in the front knee and also ensuring that your spine stays neutral. In other words, maintaining its natural curve. You will get to a point where you'll feel tension on the back of the leg and the hamstrings. Don't go beyond this point, but then slowly drive your hips forwards to bring yourself back up to an upright position. There may be a tendency for the hip to drop out and the knee to collapse in while performing this one. So visualize trying to screw your foot into the floor as though the toes are trying to point outwards. This will maintain stability in the hip and engage the muscles in the right way. If you find this difficult, then regress to doing a standard hip hinge on both feet so that you can maintain a good balance of the hips. To make this one harder, however, you can add in a pelvic rotation at the end of the movement, which will rotate the hip of the supporting leg. Just ensure that when you twist your pelvis, your knee doesn't collapse inwards. So as mentioned previously, force the knee outwards while the opposite hip moves the other way. The final exercise is a single leg lateral step down, and you can use the bottom step of your stairs at home for this one. Start with one foot on the step and the other foot off the edge, so you're sideways on the step. In a similar movement to the last exercise, start with a hip hinge, pushing the bottom backwards, and then begin to bend the knee, lowering down in a controlled manner until the heel of the other foot kisses the floor. I use this terminology as you don't want to allow the foot to rest on the floor or be used to push yourself back upright again, so it will be the lightest of contacts with the floor. Repeat this movement slowly, ensuring the hip hinge comes before the knee bend each time, and if you need an easier variation, change it to a standard step down where you're facing the step and lower the other foot behind you until the toes tap the floor, meaning the movement will be smaller. If you need to make it harder though, you can face away from the step so your lowering foot is in front of you, placing more demand on the support leg knee. If this increases your pain though, stick to the original lateral movement, but try it on a higher step to generate more movement. Like with the last two exercises, the most important point is to ensure that the support leg knee doesn't collapse inwards and it stays in alignment between the foot and hip. I hope the exercises in this video help you manage your knee pain, and I will add this to our knee condition playlist, which I'll leave a link to in the description below. If you found it useful, please give it a like by clicking the thumbs up button below and consider subscribing if you haven't already. You can also check out the description for ways that you can help support this channel. But thank you so much for watching, and until next time, stay active and keep moving to feel better.